Hey guys, welcome to our channel. We all want to be healthy, right? We take our medications as prescribed because we believe they're going to help us. But what if I told you that some of the most common medications out there, the ones millions of us take every single day, could actually be increasing your risk of a heart attack? It's true, and today we're diving deep into 8 medications that could be putting your heart in danger. We'll break down the science behind it, the specific risks to be aware of, and most importantly, what you can do to protect yourself. This is information everyone needs to know. So hit that subscribe button and let's get started. Let's talk about NSAIDs like Ibuprofen, Naproxen, and Celecoxib. They're great for pain but can increase your risk of a heart attack. Studies show NSAIDs can increase blood clot risks. They interfere with prostaglandins, affecting blood flow. This can lead to clots and heart attacks. Not everyone is at risk, but be aware. Talk to your doctor if you use NSAIDs regularly. Antidepressants, specifically SSRIs and SNRIs, are essential for millions of people struggling with mental health. But it's important to be aware of their potential impact on heart health. These medications work by balancing chemicals in the brain, but they can also affect the heart's electrical system and blood vessels. One concern is that some antidepressants can lead to an irregular heartbeat, also known as arrhythmia. In some cases, this can increase the risk of a more serious heart rhythm problem. Additionally, antidepressants can sometimes cause a slight increase in blood pressure, which over time can contribute to heart disease. Now, it's important to remember that the benefits of treating depression often outweigh the potential risks. It's all about having a conversation with your doctor. They can help you weigh the pros and cons, monitor your heart health closely, and determine the best course of treatment for you. Calcium channel blockers, or CCBs, are commonly prescribed to manage high blood pressure. They work by relaxing blood vessels and improving blood flow. However, some studies suggest a potential risk of heart attack. The reasons are complex and still being studied. Don't stop taking your CCBs without consulting your doctor. Discuss any concerns with your doctor. They can ensure you're on the best treatment plan. Managing diabetes is crucial for overall health, but some medications used to control blood sugar levels have been linked to an increased risk of heart problems. One class of diabetes drugs called thiazolidinediones, or TZDs, has been associated with a potential increase in heart failure risk. TZDs work by improving insulin sensitivity, which helps regulate blood sugar. However, they can also cause the body to retain more fluid, which can put extra strain on the heart, especially in people who already have some degree of heart disease. Another type of diabetes medication, called DPP-4 inhibitors, has also been studied for potential heart risks. While they're generally considered safe, some studies suggest a possible link between certain DPP-4 inhibitors and an increased risk of heart failure. When you're battling a cold, the last thing you want to worry about is your heart. But it turns out that some common decongestants, especially those containing pseudoephedrine or phenylephrine, can put extra stress on your cardiovascular system. Decongestants work by narrowing blood vessels in the nose and sinuses to relieve congestion. However, this narrowing effect can also extend to blood vessels throughout the body, including those supplying the heart. This can lead to a temporary increase in blood pressure and heart rate, which can be risky for individuals with pre-existing heart conditions. If you have heart disease or are at increased risk, it's essential to talk to your doctor before taking any decongestants. They can recommend safer alternatives or help you weigh the risks and benefits. Chemotherapy is a powerful weapon against cancer, but it can also take a toll on the heart. Chemotherapy drugs are designed to kill rapidly dividing cancer cells, but they can also damage healthy cells in the process, including those in the heart. One way chemotherapy can affect the heart is by weakening the heart muscle, a condition known as cardiomyopathy. This can lead to symptoms like fatigue, shortness of breath, and swelling in the legs and feet. Some chemotherapy drugs can also damage the heart's valves, affecting blood flow and potentially leading to heart valve disorders. The good news is that many advances have been made in monitoring and managing heart health during and after chemotherapy. Cardio-oncology is a specialized field focused on protecting the hearts of cancer patients. We all know that looking good and staying fit is important, but using testosterone and anabolic steroids as shortcuts can come with serious heart risks. These substances, often used to enhance muscle growth and athletic performance, can wreak havoc on your cardiovascular system. One major concern is that anabolic steroids can significantly increase bad cholesterol, or LDL, and decrease good cholesterol, or HDL, creating a recipe for plaque buildup in your arteries. This plaque buildup, known as atherosclerosis, increases the risk of heart attack and stroke. Additionally, anabolic steroids can thicken the walls of the heart, making it harder for the heart to pump blood effectively. This can lead to high blood pressure, heart strain, and an increased risk of heart failure. Heartburn is a common problem, and many people rely on proton pump inhibitors, or PPIs, like omeprazole and lansoprazole for relief. While PPIs can be effective in reducing stomach acid, long-term use has been linked to some potential heart health concerns. Studies have shown a possible association between long-term PPI use and an increased risk of heart attack. The exact reasons for this link are not fully understood, but some research suggests that PPIs might affect blood vessel function or interfere with the production of nitric oxide, a molecule important for blood vessel health. It's important to note that the overall risk of heart problems associated with PPIs is considered to be relatively small, but it's still something to be aware of, especially if you're taking PPIs for an extended period. So there you have it, 8 common medications that could be putting your heart at risk. It can be overwhelming to hear, but remember, knowledge is power. Now that you're aware of these potential risks, you can take proactive steps to protect your heart health. First and foremost, never stop taking any medication or make changes to your treatment plan without consulting your doctor. They can help you weigh the risks and benefits, consider alternative medications if necessary, and closely monitor your heart health. Remember, your health is your most valuable asset. Stay informed, stay proactive, and always advocate for your well-being.